Hello, my name is Garrett Dragu. I'm a student physical therapist at the University of St. Augustine. Dr. Campbell will be here as our CI to monitor and proctor over this examination. This is Katie. She'll be playing the patient. She has signed her consent form and is ready to go. And we had case number 1. So, after doing the subjective history, the red flags that were noticeable were the nausea and heartburn. This is a possible red flag for a GI pathology. The next red flag was the weak stream while urinating as a possible GU pathology. The third red flag was the high blood pressure. The patient had 140/90 for her blood pressure, which is stage 2 hypertension. So there could be cardiovascular problems involved with this case. And the last red flag was her temperature was 102 degrees, which would be signs of a possible infection or sickness. So after discussing the red flags, the 3 systems that I wanted to investigate further would be, the first one would be the GI. I picked the GI because of the nausea and the heartburn, as well as the liver and the gallbladder, when affected, can refer pain to the right shoulder and the mid-thoracic back. The second system I want to look into further would be the musculoskeletal system. This system is because of the patient's right shoulder pain with elevation and mid-thoracic pain with rotation and side bending. This could all be indicative of a muscle, tendon, or ligament injury. The last system is the cardiovascular system, and that's again because of the patient's hypertension, blood pressure state, and the fact that they are on cholesterol-lowering medication. So to dive further into these systems, I would ask the patient questions. For the GI system, I would ask, have you noticed any changes to tolerance of specific foods? Have you noticed any vomiting? Have you noticed any extra flatulence? Yes to any of those questions would warrant further investigation into the GI system. For musculoskeletal, I would ask if there was any mechanism of injury that caused the shoulder pain and the back pain. If there's no mechanism of injury, or if there's no position that can alleviate this, that might be indicative of a systemic involvement besides musculoskeletal issues. The last system is the cardiovascular system. And I would ask the patient if she's noted any lightheadedness, any night sweats, any sweating without exercise. If she says there is none of that, then we might be able to rule out the cardiovascular system and focus on the others. So moving forward from this, we will then begin the abdominal exam. We will do the abdominal exam because of our thought process that it is a GI pathology, specifically possible kidney, liver, or anything that's causing the nausea and heartburn. So we want to inspect that area further. So to begin, we'll have the patient lay down on her back. And Katie, do you mind if I lift your shirt up to expose the area? So we're going to start with inspection. So I'm looking for any rashes, lesions, any discoloration, any palpable masses. Nothing is jumping out, so we will move on to oscillations next. I'm going to start in the upper right quadrant. I'm listening for clicking sounds. The normal is 5 to 34 clicks a minute. After 1 minute, I'll move to the next region, the next quadrant and listen. After 1 minute, I'll move on to the next quadrant, listen for 1 minute, and then I'll move on to the right lower quadrant. If I hear 0 clicks, I would stay in either of the regions that I heard 0 clicks and listen for 2 to 5 minutes. After listening for bowel movements, I will now listen to the abdominal aorta. I'm listening for any brutes or swishing sounds. And that sounds okay. So next we'll move on to the renal arteries. Both of those sound okay. Lastly, we'll do the iliac arteries. Those sound okay. Next, we'll move on to percussion. So I'm going to percuss in each quadrant, listening for tympani or a proper sound in each region, doing 2 to 3 taps. Everything sounds okay there. I also want to percuss the liver. To do that, I find the mid-clavicular line going down. So I'll start right here and listen to where I hear it thud. About right there I hear the change, so I'll make note of that location. Now I'll work my way up. I can hear the change right there. So that distance is about 6 centimeters, normal is 6 to 12. Next, I'm going to percuss the kidneys, so I'll have the patient sit on up. So I'm going to find the costovertebral angle on the 12th rib and provide a percussion. Any pain or symptoms with that?
No.
Any pain or symptoms with that?
No.
Wonderful. I'll have you lay back down. Last part of the abdominal exam, I will do palpation. So I'll start in the upper right quadrant using 4 fingers, going about 1 to 2 centimeters deep. Any pain or symptoms with that?
No.
Any pain or symptoms with that?
No.
Any pain or symptoms?
No.
Any pain or symptoms?
No.
I can then do deep palpation, 3 to 4 centimeters in those same zones. Let me know if you feel any pain.
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Wonderful. I can then palpate the abdominal aorta. And spread my fingers until I feel the rounding of the artery, which I feel right there. Make note of the distance. Normal is 2.5 centimeters to 3 centimeters. I will then feel for rate of abdominal pulse. After 15 seconds, I felt 15 beats, so that is 60 beats a minute. All right, from here, I'm going to go ahead and palpate the liver, right under the costal margin on the right side. Any pain with that?
No.
Come over to the upper left quadrant and palpate for pancreas and the spleen. Any pain with that?
No.
And I can press in and release and do any rebound signs. Let me know if there's any pain.
No.
That. Any pain with that?
No.
Alright, so that would complete the abdominal exam. Since the patient did note increased tenderness in the right upper quadrant, we will then do the Murphy sign special test. So this is going to be testing the gallbladder and possibly the liver. So to do this test, I'll wrap my fingers around the right costal margin of the ribs. Once I get in there, I'll instruct the patient to take a deep breath in relax, breathe out. A positive sign would be increased pain or tenderness upon holding the breath. All right, so with the positive special test of Murphy's signs indicating acute cholecystitis or possible liver inflammation, the increased tenderness of the right upper quadrant upon palpation, the heartburn and nausea documented during the subjective history, and the possible referred pain to the shoulder and mid-thoracic back. I'm thinking my primary hypothesis is going to be gallbladder inflammation, acute cholecystitis, and the things that back this up are that the patient, again, had nausea, heartburn, they have pain in the right shoulder and the mid-thoracic back, which are all areas that the gallbladder refers pain to. The patient also has a fever, which can be indicative in patients with acute cholecystitis. Because the patient does most likely have an inflamed gallbladder, I'm going to refer the patient out to go see her PCP immediately and forgo physical therapy at the time being. The reason for my referral is that the patient has idiopathic new shoulder pain with no mechanism of injury, and she's also has a history of being on cholesterol lowering medication, as well as the right upper quadrant tenderness and the positive Murphy sign test. So I'd relay this information to the patient, let her know that physical therapy might not be the most appropriate thing for her at this time, and that she needs to return to her PCP for further investigation. And I would contact her primary care physician, thank them for the referral, let them know all of my findings, and let them know that once she's cleared from them, she can come back and work on shoulder pain and back pain if she still presents with that. Thank you for your time.